Hello, everyone, and welcome to the 2023 NNLM Virtual Symposium on Health Misinformation. We're really glad you're able to join us today. I'm Sean Corning, one of the Education and Outreach Coordinators with NNLM Region 7. We just have a few technical items to cover. All attendees have been muted, but we do welcome your questions and comments in the Zoom chat at any time. VFairs is providing technical assistance today. NNLM staff will be keeping an eye on the chat with me. Please be sure to select everyone from the drop-down menu and posting your comments in chat to be sure that everyone sees them. Submit questions for the speakers using the Q&A function to ensure that they don't get lost in the chat. We have a live closed captioner for this event. You can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption at the bottom of your Zoom screen. If you would like to share on social media, we encourage that you use the hashtag for the event, hashtag #HealthMisinfoNNLM. Before we get started, I would just like to give a brief introduction about who we are. So the National Institutes of Health is the nation's leading medical research agency. Many of you might be more familiar with the National Center for Allergies and Infectious Diseases, which is one of the many institutes and centers at the NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's one of the world's largest biomedical libraries and produces online resources like PubMed and Medline Plus. NNLM is the network of the National Library of Medicine. It's the outreach and education program of the NLM, and it works to ensure that health professionals and the public, like all of you, have equal access to health information. And then the NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all of which work together to provide training, funding, and engagement opportunities to over 9,000 NNLM member organizations. So it's my pleasure to introduce this session's speaker, Chana Kraus-Friedberg, a health sciences librarian at the Michigan State University Libraries. Today, she will be presenting fake news about COVID, what information literacy needs to know about health communication. Thank you all for attending, and I'll be turning it over to Chana.
Yep, thanks. So let me share oh, that's gonna stop, okay. Here we go. Okay, so let me share my screen. Thank you so much for having me. So this talk let's see if we can get this. Okay. So this talk, as Sean said, is called Fake News About COVID, what information literacy needs to know about health communication. I am a public health librarian at Michigan State University, and I also work with a residential college that mixes science with history of science and philosophy and sociology of science. So I work with a lot of intersecting fields, particularly fields that intersect with health. Just to start off with, this is sort of a very brief summary of what I want to talk about. I want to talk a little bit about what the infodemic and mis or disinformation actually mean. How librarians have responded, and also why science maybe throws an extra spanner in the works. So academic librarians particularly, but I think most librarians are used to teaching patrons how to evaluate sources at some point or another. Our methods are harder to apply to science, and I want to talk a little bit about that because I think it's something that maybe hasn't gotten enough thought in some cases. So the first thing, just to clarify some definitions, there's been a major, as everybody probably knows, there's been a major concern with fake news, so invented news since the 2016 presidential election, either invented or inaccurate. And then that very much intensified with the explosion of information about COVID in 2020. So with one thing or another, we've had a good few years where people are very concerned that they're getting information that's either inaccurate or in some other way misleading. So there's a lot of terminology. There's a lot of terminology that people have used to surround that. Most people are using misinformation as like an overarching term to cover all kinds of inaccurate information. So you can get inaccurate information not because somebody tried to lie to you, obviously, but because you misperceived what they said, or because you were in the wrong place and didn't see what you were supposed to see. You misread what somebody wrote, etc. Right? Those are all kinds of misinformation. Disinformation is what I think most people have focused on specifically since the 2016 election of President Trump. And that's a specific kind of information where the intent is to mislead. I am actually less interested in disinformation than in misinformation. And I'm hoping that you'll see why. As I continue this talk, some of these things are things that I'm still thinking about and thinking through, but because I work with a lot of science and history of science classes talking about how to evaluate popular science sources, it's something that's really impacted my work quite a bit. So I want to introduce another term which probably many people in the audience may be familiar with, which is the term infodemic. I think a lot of people have been using the word infodemic to be sort of interchangeable with either misinformation or fake news, but in fact it's not. So according to the WHO, the World Health Organization, an infodemic is just a glut of information. It's just too much information during some kind of disease outbreak. It doesn't really matter whether the information is good or bad or correct or incorrect, but because there's so much of it and there's not enough of a structure to evaluate it, people end up being confused and doing risky things. And they also end up not trusting the health authorities that are giving them this information. Again, all of this information could be true in the sort of information that forms a part of the infodemic. The idea is that it's just a lot of information about something health related in an emerging situation where you don't really know what's going on. And so in the face of fake news and in the face of the infodemic as part of COVID-19, librarians have kind of come to the fore in that many of us have been eager to participate in fighting fake news or people's propagation of it, people's belief in it, or in fighting false information about COVID-19 or vaccination with good reason. And there's been a feeling that librarians are the people to do this because a lot of our area of expertise is information, right? We help people find reliable information. And that's explicitly one of our jobs. Usually another part of our job is explicitly to help people evaluate sources for their usefulness for particular purposes, whether that's in a public library or an academic library or a corporate library. And in general, our kind of code of ethics incorporates the idea that that we want to have a well-informed citizenry, that we want people to have access into information, and we want to facilitate that for them. So librarians have kind of been like, well, information is our bailiwick. Like, this is our area. We should be able to be a big part of the solution here. And whether or not that, there have been many different kinds of efforts that have gone on since 2016 by librarians and other people to fight against misinformation. I think that some are more successful than others. I think it's difficult to quantify whether all librarians are well positioned to address this issue. Some may be better positioned than others for various institutional reasons. But there's definitely been a lot of talk about it. And librarians certainly have the advantage of having access to a lot of information and knowing how to find and evaluate it. And so that's been kind of our entry into this problem. The thing that I think comes up ordinarily, or for me at least in instruction, when I work with undergraduates, has come up ordinarily during research, but I think is very, very much heightened during any kind of infodemic situation, any kind of emerging situation at all, but particularly any kind of situation where science and health is at play, is that, and this has been a major question among people who study health communication for decades. Science, as many of us know, if we work with original scientific research, or if we help people find it, is based on the idea of uncertainty, right? You can never say with 100% certainty that something is correct or not correct. Every scientific experiment is basically an educated guess, or a series of actions following on educated guess. Which is as it should be. We always know that science can be superseded by better science, and this is what I talk to the undergrads that I work with about all the time, and their professors. The problem with that in general is that people, and you can see Rabinovich and Morton, this article predates both COVID and the 2016 presidential election. The big problem with that for situations where you want people to act quickly and decisively is that people really like to act on certainty. That's one big problem. And the other big problem is that if you present scientific information as though it was certain, as though it were as certain as people would like it to be before they act on it, you're creating a kind of misinformation. It's sort of a misinformation of nuance in some ways. But that does do what the WHO was talking about when they talk. It breeds a certain kind of distrust in science itself, and it also in government and larger sort of international efforts to work against an emerging health situation or to work to contain it. Many people I've heard people sort of talk about this two ways. Some people will say, oh, well, science always changes, so there's no point in really paying attention to it. And then some people will say, I believe in science. This has been a popular slogan over the past few years. But to believe in science is not always the same as believing in some particular thing that one study has said. You can believe in the scientific process without believing in that one particular study, because the nature of science is that study probably could be wrong in some way, or the results could be wrong or superseded by better. So this is one of the real big issues in health communication, and that especially during an emergency, you want to communicate to the public in a way that encourages them to take action, but you also don't want to be misinformative, and that you don't want to present something as certain in a way that it actually is not. It erodes trust, as I said, and it also just provides people with information that's not true, not maliciously, for a very particular purpose, which may be beneficial or important, right? You want people to get vaccinated. You want people to be masked, but it introduces a little bit of a spanner into the works when you want to think about how to evaluate sources, or how to show patrons how to find reliable scientific research. And I'll talk a little bit more about why. The other thing that, in addition to and some of this may be very, very familiar to people in the audience. So if that's true, bear with me. But the other thing about science, aside for the nature of science, which is that it's always building on top of what comes before, and it's always improving on it in theory. Some other things that cause problems with conveying, or some other things that cause problems with conveying how science really works and what how to see uncertainty in the context of science. When you're working with people who are looking for, so am I supposed to mask or not? There are a few other aspects of science and how we get it or how it's disseminated that can cause some problems. Many of us, and I would say that this is true even sometimes of scientists themselves, unless you happen to sort of to read about it or to be very closely involved with it. I have read about it and spoken to people about it, although I'm not as closely involved. One of the things that you become aware of is that there's a process behind how we get science that is invisible to most people and that really impacts the information that we get, sometimes in unintentionally misinformative ways. So one thing to consider is the role of press releases in science journalism. A lot of us get our, let's say, news about COVID from either journalism, so from newspapers or from other from other news media, or from policy releases, right? Like, so from the CDC telling you how many days you should isolate. One thing at least about science journalism is that it gets a lot of its information from press releases that are put out by academic and corporate institutions. These are the places where the research is actually being done. And so if a study is done and either turns out well or finds something interesting, a press release will go out, and that will be more likely to be featured in the next day's paper or the next week's science blog than otherwise. The problem with press releases, of course, is that press releases are press releases. They're meant to be publicity vehicles. And the other kind of problem with them is that they're meant to celebrate particular events, right? So they're meant to make it seem, and I mean, this is the nature of what a press release does and is, right? They're meant to make it seem that something happened, it was very, very important, and it's groundbreaking. So when the press, so when journalists use press releases for that purpose, it ends up kind of filtering down to the rest of us, right? Many students that I've worked with, and many non-students that I've worked with too, see science as a series of breakthroughs rather than as just kind of a slow accumulation of evidence. And that is problematic because, again, it makes it seem as though science that comes out and then is superseded by something better is incorrect, right? If at first it seems like you should wear X kind of mask, and then then it seems like you should wear Y kind of mask. There's a tendency to have mistrust in the gap between those two things, partly because you're being presented with something that really is an ongoing process, as though it were made up of like exciting episodes. During COVID in particular, and this is something I experienced because I was working as part of the Librarian Reserve Corps, who created a tagging system and tagged articles that were coming out during the beginning of COVID for the World Health Organization. During COVID, another thing that happened that kind of introduced additional uncertainty or additional problems into how we evaluate sources, was that the peer review process just got bogged down. And this is the result of an infodemic, right? Like, there's so much information coming out there just wasn't enough space to have it all be in peer-reviewed journals, and yet it was the only information in a lot of cases that people had about COVID. So workers in the field, as well as workers in the field as workers who might be WHO workers out in the field, people who are interested in things for the reasons of their own health. That was kind of all that they had, was the new stuff that was coming out. And as a result, a lot of scientists started trying to use alternative methods of getting their science out there. So one such method that I can think of, which I thought was interesting, was that scientists started sending their accounts of their research into letters to the editor in peer-reviewed journals. Obviously, letters to the editor are not peer-reviewed. There was growth in the number of articles that were published in disciplinary repositories, for example, even without being published in journals first. There was the very controversial dissemination sometimes of scientific results on places like Twitter, which there's kind of a wide agreement that that's not where science would ordinarily belong. It puts it again, if you want to show people how to evaluate scientific information, it puts you in a little bit of a bind, especially because we as librarians usually show people how to look for authoritative sources at the point where the authoritative sources don't have space for the information that's necessary. That becomes much harder, and you have to think, I think, more carefully about what it means to about who you're thinking of as an authority. So is the scientist the authority? Is the body of literature the authority? Is the peer-reviewed journal the authority? Because we're used to those three things coming together, and suddenly they weren't. So I see that there are questions in the chat, and then there's also a question in the question and answer box. I'd rather hold questions till the end if that's okay. But I'm not ignoring you. The other thing that happened the other thing that impacted this kind of pipeline is that science journalism has gotten less and less support and investment, and this happened. There was actually a big leap downward in terms of the number of science journalists left in newsrooms during COVID, which is sort of distressing. So science journalists usually are not science researchers. They are getting information often from press releases. They may not have the background in some cases to understand the way that things like uncertainty are being removed or excised or avoided in the press releases, because that's what a press release does. They may not have as good of a sense of the landscape of how scientific publication happens. So why it's different to publish something as a letter to the editor than as an original research article, and why you might choose to do one or the other. There's also the fact that journalism, similar to public relations, is subject to the attention economy. So there's also a tendency, and this is something that I think this to me, I think, is the biggest and maybe most concerning issue when it comes to science misinformation. There's also a tendency to present things as though they are isolated events, so that each experiment or each study becomes an isolated event instead of the continuation of things that have happened before, so that new instructions don't seem like improvements on the old instructions. Like, oh, we found out better, and now we realize that this kind of mask will actually work better, right? It seems like somebody saying, oh, we found out that masks will work, but oh, we realized that they actually didn't work unless you do this. It's a really subtle difference in framing. but it's an important difference because it really impacts, as I'll show you in a second, it really impacts how people think about trusting science and how people think about taking action um, based on policy or science policy. And again, there's, because of those things, and also just because I think because in the public sphere there's a limited amount of time spent drawing lines between these things. There's a lot of public confusion between what is science and what is actionable or recommended policy, right? So when people say that they believe in science, they're saying that they trust policy that comes from science, right? They're saying that they will abide by policy that's made based on science. But in fact, science itself doesn't usually give you anything actionable at the end, right? So scientific studies don't tell you at the end. Usually what they tell you is, maybe if you're a researcher, you should go on to study X. They don't tell you you should wear a mask necessarily. That's not how research works. And when people face that confusion, I think there's also a lot of mistrust that slips in, where they feel like science is supposed to be doing something. It's supposed to be giving them an answer, and it doesn't. So any of these can sort of intervene between how people's thoughts about science and how they actually would need to evaluate it in order to get what they're looking for. Often you'll hear people say that people want to do their own research. And I've worked with lots of classes where actually that's part of what they do. They'll trace a claim back from a popular source, either to other popular sources or sometimes to the original article itself. But of course, if you trace it back to the original article, that doesn't mean that you get actionable recommendations. It means that you know where the information comes from. And that slippage, I think, can really contribute to people's lack of understanding of what's going on. Oops. See why that's happening. So this is an information literacy framework that created by Mike Caulfield, which is often used by librarians in academic libraries to talk about source evaluation. And in particular, Mike Caulfield, who is I think is an information literacy expert, has created sort of a series of resources for how to use this on health information during COVID. A lot of librarians use it. I think it's very good. What I wanted to point out, based on what I just said, were a couple of places where it falls apart a little bit when you're looking at health information, especially in an infodemic, and places where you might want to think about changing it a little bit so that you can address what really are some different challenges, I think. The idea behind the SIFT method is partly that you become aware of your own feelings about whatever it is that you're reading. So if something matches your views, you're more likely to agree with it. The idea is to stop yourself before you, let's say, share it with other people and kind of investigate beyond what you feel. So the steps are: stop, investigate the source, find better coverage, trace claims, quotes, and media. There was an earlier iteration called 4 Moves in a Habit. The habit was to stop and become aware of your own emotional thoughts about things. He's obviously shortened it a little bit. So stopping is pretty much always the same. You see a thing and you have a feeling about it based on your political allegiances or your personal allegiances or your personal experiences. And the idea is to not take those as read, like not to just sort of go on those. Something I had a similar response to something I think of when I think about stopping is that Sweden, for actually the entire pandemic, has not masked. It hasn't been their policy. They had other things in place. As a country, they've been pretty confident that this was the way that they were going. I almost didn't believe that when I read it. I was like, no, of course they mask. They have the Nobel Prize. They believe in science. And I know they do, but it's actually true. There was a kind of there was something that went counter to what I expected. And as a result, my first instinct was to be like, I don't think that that's true, but it happens to be. Second, to investigate the source. When you're looking at and this separates it a little bit from the question of Sweden, but when you're looking at scientific sources, one thing that you really need to do is think carefully about what you want the source to do for you, what it is that you're actually looking for. So do you want to know if the source do I want to know whether it's true that people in Sweden haven't masked as a matter of policy? Or do I want to know why they're not doing that? Like what research they're basing that on? Do I want to know whether it worked for them? Do I want to know if it's something I should do? Like, is it better for me not to mask? All of those require different kinds of scientific work, and most of them are not original research. In fact, none of them will really be answered by finding one study that tells you this is an argument for not masking during the pandemic. They will all involve other kinds of documents than one original research article. And so when you investigate the source, it's often good to think about the landscape of different ways that science can be communicated, which is something that I think when you're investigating something like the news, documents, emerging news is a much more horizontal plane. So the documents that you're looking at may be more similar to each other, and there may be a smaller range of them. Oops. Yeah. Finding better coverage, again, can be difficult because a lot of the coverage, the news coverage at least, that you're seeing comes from press releases, and the press releases will be pretty similar. How much time each individual journalist has to dig will vary. The kind of publication that they work for will vary, but oftentimes a lot of the coverage will be very similar. And I found this with classes when I've worked with them to find original articles. One of the things that they'll find is that it's easy to trace it back to the source because often most of the articles have the same source. And it's also important to think just quickly about what it means in science to find better coverage. So better coverage is not necessarily always more detailed coverage. It may just mean that it's more upfront, and I'll talk about this in a second. It may just mean that the coverage is more upfront about the clinical applications of whatever it is, or that it's more upfront about the downsides or the limitations of the study that's been done. That it's more transparent about what stage the study is in. So if it's in the stage where something's being tested on mice, it's not a breakthrough yet. Finding better coverage for science is a little bit different because it has those very specific things that you would want to know. How much per patient is this going to cost? What are the side effects and how many people will be impacted? Those are really specific kinds of information that you might want. The last step is to trace claims, quotes, and media to the original context. Again, this is difficult to do because the original context, the real original context, is the single original article, which will not always help you. Another thing that I discovered while I was reading health communication. And this really surprised me because I've always heard scientists and science librarians talk about this as a problem. One article said, and I guess if you're a science journalist, you can say whether this is true, that people try to get quotes from people who are not the ones who did this study, because it's a way of introducing balance, because they're like saying, from my perspective in this field, this is an important study. I think often to researchers, that seems weird, because it means that you're not having the people who did the study explain it. And there's a sort of sense that people who are in, because research can be so siloed, people who are in very slightly different areas of research may not fully understand what it was that they were trying to do. So that's kind of an interesting side note. And quotes and claims are pretty much as they are. Sorry, claims are pretty much as they are, I think, in ordinary news stories. But for all of it, you have to keep in mind really what kind of information you want ultimately from the article, and what you think, what kind of document will give you that. It's a little bit wider, and it's a little bit less less well-known or less interacted with, I think, than ordinary documents that are the basis for journalistic reporting. So just and again, this might be completely elementary to people. These are things that I think about when I work with classes. So some tells for problematic either health journalism or consumer health information, which includes policy documents from the CDC. If the report that you're reading reports percentages without citing the size of the sample, I've seen a lot of people do this, and I've seen a lot of people refer to these as either relevant or accurate, even though they're sort of introducing a kind of, probably not malicious, but a kind of misinformation into the mix. This is something that press releases often do. If the document hypes up what a medicine can actually do, this again makes it seem more exciting and more like a breakthrough, but it's not that useful for a patient. If it posits something is definitely effective all the time, nothing is definitely effective all the time ever. If it doesn't identify risks is another thing that will often happen. And again, you can see how all of these would fit within the genre of a press release, let's say, right? Because part of the job of the press release is to make it seem like something, like a big deal happened, and it may have, but not having this information means that you're getting a slight level of sort of misinformation from what you're reading. When it doesn't clarify what the stage the research is at. So again, research on mice is research on mice. It is not yet groundbreaking, although it may be important. And the final one, which is the one that I actually have as sort of in my personal life, have the most trouble remembering, is when you're reading an article that doesn't explain the clinical significance of research as opposed to statistical significance. So meaning, if you say that, if you want to say that 2 out of 5 people would be cured by this, but in fact, in the entire population of the country, only 2 people have this condition, it's not that applicable, right? It's impacting a really minuscule number of people, even though you could still say, well, a very high proportion of these people would be impacted, and therefore we should go ahead and use it. There are often other considerations in terms of how many people actually need something, and that's something that I often have to sort of stop myself and think about, and I think it's something that people often don't think about, perhaps as much as they should. So my main, a lot of this is a lot of these things are things that I'm sort of trying to think about, so it's perhaps a little bit jumbled. But the main thing that I think is important when you're talking about when people are trying to show other people how to evaluate science sources, science information of any kind, or scientific sources of any kind, partly is that it partly is just the basic understanding that science is a joint endeavor, like it's a team sport, and that no one study is for sure. I think that that's something faculty that I work with really emphasize that to their students, and studies have shown that it's actually one of the things that makes people least likely to mistrust new evidence as it comes out, is the understanding that science is kind of a progressive movement towards better information, hopefully. People who see science as black and white tend to be much more mistrustful in the longer run. It's helpful, although people have varying degrees with this. Mine is not anywhere near as much as I wish it was. It helps to have, as opposed to thinking about what kind of source is authoritative, it can be helpful to think about what kind of source, how the source got where it was going. So even if it's based on something authoritative, how does it have to get translated in order for people to use it? And what does that mean about what it looks like when you read it? And the bottom line is that this is something that I've read a lot of people writing about since 2016. The bottom line is that librarians, because we are, because information is our kind of our stock in trade, we always have pretty strong feelings, I think, that more information will help. I have strong feelings that more information will help. I think that if I tell people more about these things, they will know more. And that may or may not be true, but it turns out that the real kicker is the framing. That it matters more that you know that the information will change than that you have a lot of information to begin with. And that to me is like a real shift in thinking. But it seems like, especially with, and it can impact non-health related news as well, but it seems like especially with health related news, and especially in a pandemic, it becomes even more and more important that be an expectation that that things will change, and that you have to kind of be willing to expect that. So that is what I have to say. The one other thing that I have to say that I think introduces a little bit of a spanner into the works in terms of the kinds of scientific documents that people look at, is that during the pandemic, because people had such little information, things like case reports where it's written about one patient became useful because that was all people had. And people in general tend to kind of glom onto anecdote. Like if I read a case report, I'm like, oh, it happened to this person. That makes sense that it would happen that way for everybody. It's hard to, I think, usually this is not something that is necessary, but looking at very small amounts of information like case reports in sort of the context of the broader range of possible documents that are out there is also important, like making people aware that there are such documents, that they're useful for very limited purposes, but that in an emergency situation, they're what you have. The idea that the science that came out during COVID, especially in the beginning, was what people had, as opposed to what maybe is ideal, is probably also part of looking at uncertainty. So thank you so much. That is the end of what I have to say. So I'm not sure how this should work. Are we going to go directly to Q&A? I see there are 3 questions and possibly another one.
Yeah, we can go straight to the Q&A. I can read off the questions from that were submitted if you'd like.
Sure.
Yeah. So the first question, so a few questions from Sivana Roos. The first one is, who decides what health communication messages are shared and who delivers the message nationally? Why are news media presenting health infos, and aren't studies presented in the news misinformation due to how they're being taken out of context?
Okay, so that is actually, I will start by saying that I have less information on that than I would like. But what I've gleaned from talking to people who are science journalists is that there are a combination of things. One is that there's a major central, I'm not even sure what you would call it, like a database of press releases that have to do with different kinds of research and different kinds of subjects. And if you have access to that database, which is, I believe, proprietary, although I don't remember which company owns it, you get early access. So you're seeing those press releases before they come out. Part of what that means is that there's a kind of structure that limits who can write about what. It depends on whether or not you get access to that information. Other people who decide which health communication messages get out, are partly public relations offices in universities and companies. So what sounds like it could be exciting. Again, that's what I meant by the attention economy. Like, you want things that sound like they could be breakthroughs, because that's what people will read. You want something usually that it sounds like it's relevant to people's lives. So in newspapers, you'll usually get things. I mean, and you kind of probably know this from just seeing it. In newspapers, you're less likely to get things about, let's say, fruit flies, although you may. You're more likely to get things about, let's say, health sciences, because those are things that people are actionable for people. The question of why the news media are presenting health information is, I think, probably a larger question. One reason, obviously, is that during COVID, health information was news. Another reason is that there used to be more quasi-specialist journals, I want to say. So Popular Mechanics and Popular Science are good examples of this, where they were for people. They're for people who are not scientists, but the idea is that people who are not scientists can read them and get good scientific information. There are fewer of those now. And the other, just as another answer, so the government entities like the CDC also decide what kind of information gets out, not in that they're hiding anything, but in that they are the ones who pinpoint what's important for the nation to know, and what kinds of actions they should be taking. So you're also asking, Sean, you wanted to answer a question live. That's what it says.
Oh, sorry. No, that was just me clicking that you were answering it live. Sorry.
Oh, okay, gotcha. Okay, so your last question is, Stevana's, what role does bias have in the SIFT method? The idea of the SIFT method is partly that it encourages you to stop before you act on your own biases, meaning you see something, you feel like it's probably true. Stop before you make that assumption and look into it. That's kind of the purpose of the SIFT method, and I think that it works. I think the idea is that you should learn to become aware of your tendency to agree with things that you already agree with. You're also addressing bias in the document, and that you're looking for alternative sources. So if one document says something that's wildly different from what every other source says, or if in comparison to other sources, it seems unlikely that's something that you're going to get at by using the SIFT method, if that answers your question.
All right. I just have one question myself. I just have a question. Do you have an idea of approaches for people or journalists who are using low sample or kind of like single patient case report data or sources to kind of support a particular stance, and are a little bit resistant to kind of other sources? Because sometimes that does happen where people are kind of latch onto a source that might be supporting their view already.
I don't, because I think that I don't think that it's as, in my experience at least, it's not a question of like one or two journalists who are doing it. It's a question of science journalism being a profession that is, like a lot of professions, trying to do way more with way less all the time, so that they have less time to look into, like, to find more background or to speak to more people. There used to be unfortunately, I was looking at it before this talk started. Unfortunately, it's not really there now, but you can see it on the Wayback Machine. There used to be a website called Health News Reviews, which I can put it in the chat if I'm allowed. So it's now defunct, but you can see it on the Wayback Machine. And what they used to do was actually review individual science news articles, where they had a rubric and they would go through them, and they would say, okay, so do they talk about possible harms to patients? Are they making it out that this medicine can do things it actually can't do? A lot of the things that I use come from there. And what you end up seeing on that list is that it's really kind of everybody and nobody. People are working often in situations where they don't have enough time to be able to appropriately translate things that are complex, and that's kind of what happens. I don't think it's anybody's intent to misinform or to sort of force their opinion on people. Usually, I think it's more a question of expediency.
Okay, that makes sense. It's really helpful. And I'm really intrigued by that defunct Health News Reviews site. I'm definitely going to check that out.
It's a great, they had explainers for journalists and other people where they take apart each source of bias and each kind of statistic, so that you can see, when you're reading it, you can see what you're reading. It's actually really great.
Oh, that's fascinating. It's a shame that it's not continuing anymore. We have a couple more questions that came in. Do you have any thoughts on predatory journals? I kind of pay to publish type journals, and whether they're a source of mis or disinformation for perhaps particularly for science journalists?
I think that's an interesting question. A lot of the time during, and I am definitely not an authority on it, a lot of the time during the pandemic, there was sort of an explosion of upset about predatory journals, in part, but also kind of conflating or fusing predatory journals with disciplinary repositories, which are not the same. The idea was that neither one of them is properly peer reviewed, and therefore they must be or probably are misinformative. I think it's one of those things that's really hard to tell, and it's a side effect of the fact that that the peer review process was not equipped for an infodemic. So are things necessary? Do predatory journals potentially allow for these things to happen, or is it easier for them to happen in that kind of context, yeah, probably, possibly. Does it mean that it never happens otherwise? No. Was there a reason why is there a reason why literature was coming out that way, so through things that were not peer reviewed? I think yes, and I think it was sort of an understandable reason, I guess, if that answers your question. I think that's a very hard question to answer. So Laurie asked, do you work directly with science journalists or know of any collaborations between librarians and science journalists? I know some science journalists. I have not worked with them professionally on projects that are related to this, although I have worked with people who work on health communication, so in academia. So I guess there's a tie there. I also know a lot of librarians and faculty members who work with science journalism, and so it wouldn't surprise me if there were librarians and science journalists who are working together. I think it's probably likely. I just don't know any. In my personal professional life, I don't know any personally. So Stevana Roos asked, are you aware of local TV news outlets having paid sponsorships from local hospitals that they allow their doctors to be interviewed and talk about health conditions that have the purpose of promoting their business? Do you think the general public realizes the potential bias of this? Again, I know that this happens. I'm not an expert in how often it happens because it's not an area of this fact that it happens is not an area of expertise for me. And so I don't know what people do and don't realize. I suspect it's pretty similar to journalism in general, where you now have sponsored articles. And I did a little bit of research into that a few years ago, and I think that I would say that most people don't realize, or certainly potentially don't realize, that sponsored articles are not actually like the views of the newspaper or news that the newspaper is basing just on what happens, that they're kind of quasi advertisements. So I think that there's a good chance that some of the public at least doesn't realize that that local TV outlets may have sponsorships from local hospitals. There's also a change in the media landscape such that there are fewer local TV news outlets. So that's a change too. And that whole area is something that I certainly cannot claim to be an expert in.
Well, that brings us to the end of the time. Thank you so much, Chana Kraus-Friedberg. And I've just got a couple last minute things.
Oh, thank you. Oh, really? Stop sharing.
Yeah, thanks for attending. If you're interested in claiming the MLA credits, those will be the instructions to claim those will be emailed after the day 3 of this event. Join us for the next session after a half-hour break at the top of the hour. So we've got a half-hour break until the next session. We encourage you to visit one of our virtual booths for the exhibit, grab a quick bio break, get away from your computer, and then welcome you back for our next session. Thank you so much. And then also, if you'd like to continue exploring health information, I'd just like to make you aware of our upcoming health misinformation webinar series, which kind of continues a lot of the stuff we've been talking about at this virtual symposium. It starts April 14th and it goes through September. And if you'd like to learn more about that, you can check it out at our training site. Thank you so much for attending, and we'll see you at our next session.